الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Today we are going to discuss tuberculosis by Professor Mahmoud Hani Sulaiman. Occurrence worldwide organism Mycobacterium tuberculosis human bovine strains mainly. Reservoir humans and cattle. Transmission airborne droplets, nuclei, and dust, milk and infected meat. Prevention and control, general improvement in housing, nutrition, personal hygiene, immunization with BCG, chemo-prophylaxis, case finding and treatment dots. This is the acid-fast bacillus smear showing Mycobacterium tuberculosis bacilli in red. Primary complex. On first infection, patient develop primary complex consists of a small parenchymal lesion and involvement of regional lymph node in lungs, the classical Gon's focus. In most cases, primary complex heals spontaneously with fibrosis and calcification of lesions, but organism may persist for many years within this focus. Thus, within a few years of primary infection, especially during first 6 months, there is danger of hematogenous spread, either focal, e.g. bone and joint lesions, or disseminated in form of miliary TB and tuberculous meningitis. Pulmonary form of TB occur either due to reactivation of an existing lesion or by exogenous reinfection. Destruction of lung parenchyma with fibrosis and cavitation are important. So, destruction of lung parenchyma with fibrosis and cavitation are important features of this adult form. Clinically, TB may present with chronic cough more than 3 weeks, hemoptysis, chest pain, or with general constitutional symptoms like fever, loss of weight, and malaise. Often it remains asymptomatic, especially in early stages. Lab diagnosis. Demonstrated by Ziehl-Neelsen method, definitive diagnosis of TB rests on isolation of MTB or M. bovis from sputum, urine, biopsy material, CSF, or other clinical specimen. Lab diagnosis: acid-fast microscopy, mycobacterial culture, nucleic acid amplification, drug susceptibility testing. This is as you see chest X-ray showing bilateral miliary have millet sized infiltrates in a child يبقى bilateral miliary TB. This shows the arrow, the blue arrow, right upper lobe infiltrate and cavity with air fluid level in a patient with active TB. Cavity with fluid level. The blue arrow, large cavity, CT scan showing large cavity in right lung of a patient with active TB. This is MRI of culture confirmed renal TB. At the level of thoracic to weighted coronary plane, coronal sections showing several renal lesions. On the arrow is indicating it. Several renal lesions in both cortical and medullary tissues of right kidney. This is a CT scan demonstrating destruction of right pedicle of thoracic 10 due to Pott's disease. Patient, a 70-year-old Asian woman, presented with back pain and weight loss and had biopsy-proven TB. Tuberculin test. Purified protein derivative, PPD, is used. It is delayed hypersensitivity type. Read in 48 or 72 hours. In Mantoux test, material is injected intradermally. Positive reaction denoted by an induration hardness of 10 mm diameter or larger in response to 5 tuberculin units. 5 tuberculin units. This is how we measure the induration by this ruler. This is about 15 mm diameter as indicated by the ruler. This table shows the definitions of positive tuberculin skin test (TST) results in infants, children, and adolescents. There is no one cut-off point for the tuberculin test, but for every case there is different cut-off point. Of course, as we said, reading the result is by special ruler. In the last slides we saw it. And another remark on this table, with increased risk we decrease the diameter of the positive test. We will read this table from below. So in duration 15 mm or greater for those children more than 4 years without any risk factors and adults. In duration 10 mm or greater, children with increased risk of disseminated tuberculosis and children with likelihood of increased exposure to tuberculosis. Those at increased risk of tuberculosis, younger than 4 age, other medical conditions including Hodgkin disease, lymphoma, diabetes mellitus, chronic renal failure, malnutrition. That is to say, cases in which immunity may be decreased. Children with likelihood of increased exposure to tuberculosis are children born in high prevalence regions of the world, children who travel to high prevalence region of the world, children frequently exposed to adults who are HIV infected, homeless, users of illicit drugs, residents of nursing home or institution. They are resident in institutions. In duration 5 mm or greater, children in close contact with known or suspect contagious people with TB, children suspected to have tuberculosis disease, those with finding on chest radiograph and clinical evidence of tuberculosis. So the most important thing, when the risk for TB is increased, we decrease the diameter of the reaction, and a special ruler is used to read the test. Epidemiology of TB. TB has a worldwide distribution. Until recently, it was absent from few isolated communities, but now showing widespread infections with severe manifestations on first contact with TB. This is the incidence rates per 100,000 population in 2008. This is Egypt. Incidence is low. As we just said, reading tuberculin test and putting a cutoff point needs you to know where they reside, the child or adult is residing. This is first. Second, you can work after graduation, you can work in any of these places. You can work inside Egypt, in Gulf area, in Africa, Latin America, North America, Asia, Europe, any part. So you must know the distribution of TB. Reservoir of infection, humans are a reservoir of human strains. Patients with pulmonary infection constitute main source of infection. Reservoir of bovine strain is cattle with infected milk and meat being main sources of infection. Transmission. Transmission of infection is mainly airborne by droplets, droplet nuclei, and dust. So all methods of transmission, respiratory transmission, are present in TB. Thus, it is enhanced by overcrowding in poorly ventilated places. So, one of the methods to prevent TB, to prevent overcrowding, to make clean houses. Infection may also occur by ingestion, so food hygiene is important to people, so they do not eat contaminated meat or milk, especially contaminated milk and infected meat. Host factors. Host immunity is an important factor in epidemiology of TB. A primary infection may heal host acquiring immunity during process. In some cases, primary lesions will lead to extensive disease locally, or infection may disseminate to produce metastatic lesions. Certain factors as malnutrition, measles infection, and HIV infection, use of corticosteroids, and other debilitating conditions predispose to progression of and reactivation of disease. These are the risk factors for developing active TB from latent TB infection. HIV or AIDS. One or more of the following medical conditions. These are the conditions which debilitate, which weaken, which decrease immunity. Intravenous drug users that are HIV negative, diabetes mellitus, silicosis, renal failure, and those on chronic hemodialysis, immunosuppressive therapy with steroids, TNF antagonist treatment, chemotherapy, hematologic malignancy, head and neck malignancy, chronic malabsorption syndrome, intestinal bypass or gastrectomy. TB infection documented in the previous 2 years, healed prior pulmonary TB, history of active TB in the past, but treatment was incomplete or inadequate. Prevention and control of general health promotion, improvement in housing by good ventilation, avoidance of overcrowding will decrease chances of airborne infections. Health education directed at producing better personal habits with regard to spitting and coughing. Good nutrition enhances host immunity. Specific protection. 3 measures are available for specific protection: active immunization, chemo-prophylaxis, control of animal TB. Active immunization with BCG, Bacille Calmette-Guerin. BCG is an abbreviation of Bacille Calmette-Guerin. Bacille means bacillus. Calmette-Guerin are 2 scientists who made this vaccine. Chemoprophylaxis and control of animal TB. BCG vaccination contains live attenuated tubercle bacilli of bovine strains administered intradermally by searing and needle or by multiple puncture technique. It confers significant but not absolute immunity. In particular, it protects against disseminated miliary lesions of tuberculosis and tuberculous meningitis. It does not given to protect against TB, but to protect against disseminated miliary lesions of tuberculosis and tuberculous meningitis. And tuberculous meningitis is used to measure the success of BCG in the community. الأخير انتشاره في المجتمع يستخدم لقياس نجاح التطعيم. Immunization strategy. BCG vaccination of newborn is widely practiced in tropics. It confers considerable protection against TB in infants and young children, and this is done in Egypt. Vaccination of newborn. Strategy in API, expanded program of immunization, is to give BCG a few months after birth, within 3 months of birth. In some developing countries where tuberculin testing may decrease coverage, BCG given in mass campaigns without tuberculin test. Disadvantage of this method is that those who are tuberculin positive may show severe local reactions at site of vaccination. BCG may also be used more widely in immunizing tuberculin negative persons, especially children in community. BCG vaccination used selectively in tuberculin negative persons at high risk, for example, those close contacts for TB, doctors, nurses, hospital wards attendants. So you see here strategy for immunization. Strategy means method, way. Strategy of immunization may differ from place to place. In Egypt, BCG vaccination of newborn within 3 months of delivery. Chemo-prophylaxis. Isoniazid is effective in preventive infection and progression of infection to severe disease. Treatment with isoniazid for 1 year is recommended for close contact of patients, persons with seroconversion from tuberculin negative to tuberculin positive in previous year, children less than 3 years who are tuberculin positive from naturally acquired infection. In tuberculin negative person giving BCG or isoniazid decision, which method to use depend on local factors. You see, again, the decision may be different from place to place. Acceptability of regular drug therapy and availability of effective supervision. Of course, if you are going to give isoniazid, you must have regular drug therapy and supervision must be present for the treatment. Control of bovine tuberculosis. Idea to maintain herds free of TB. The idea is to maintain herds القطعان free of TB. Infected animals identified by tuberculin skin test and eliminated. After slaughter, carcasses of cattle examined for signs of TB. Infected meat should be condemned. Milk, especially from herds that not certified TB-free, should be pasteurized. Early diagnosis and treatment. Case finding operations should aim at identifying active cases at an early stage of disease. This depends on maintaining a high index suspicion in clinical practice, doing routine screening, especially of high risk groups. Screening include tuberculin testing, sputum examination, and chest X-ray exam. Tuberculin, we mentioned it. Sputum, microscopic exam of Ziehl-Neelsen stained smears of sputum. Microscopic exam of Ziehl-Neelsen stained smears of sputum. A simple, cheap screening technique, especially useful in rural areas of developing countries where resources are limited. Chest X-ray, mass miniature radiography, MMR, was widely applied and was especially valuable in detecting pre-symptomatic disease, but it is expensive, needs training, little specificity. High risk and special groups for screening. Contacts of TB patients, persons with cough persisting for 3 weeks, healthcare workers, dust exposed workers. So it is an occupational disease, TB. For this we screen special workers, healthcare workers or dust exposed workers, teachers, food handlers and other persons who come into contact with public, immigrants from high incident regions. Treatment. This table shows the dose and the regime for taking the treatment for TB. Isoniazid, rifampin, pyrazinamide, ethambutol. Isoniazid, rifampin, pyrazinamide, and ethambutol. And these are the doses. Isoniazid 5, rifampin 10, ethambutol 15, pyrazinamide 25. There is a daily dose and there is a thrice weekly dose. Okay, please read carefully and print this table. Still in treatment. Duration of treatment with individual drugs varies by regimen as detailed in last table. Okay, the duration in the last table. This again, the doses and the regime for these drugs written, so you can print it and keep it in your file. This map indicates a very known case of resistance to tuberculosis drug, anti-tuberculosis drugs. This map shows the percentage of new tuberculosis cases with multi-drug resistance. Okay, the percent. Here Egypt is less than 3% of cases have resistance to anti-tuberculosis drugs. As you see, the high and the most high are here and here. Thanks God we do not have this. This is the schedule for compulsory vaccination in Egypt. I put it only to show that BCG vaccine is compulsory within the first 3 months, and these are the other vaccination. Please print it and keep it in your file. These are the additional vaccinations for children and adults. Please print it and keep it in your file. وفي النهاية لا أجد إلا أن أقول الحمد لله رب العالمين و thank you for your listening.